Sure. So can I take it?
Yeah, I'll be inviting Dr. Ashok Puranik. He will be speaking on tissue engineering.
Okay. Thank you, sir. I also want to invite Dr. Mandeep Sachdev, sir is Registrar, Haryana Medical Council, to please chair this session. For our next talk, Dr. Ashok Puranik, sir is the Executive Director, AIIMS Guwahati.
Good morning, everyone. I have a confession. Like people have trouble, when they make a mistake to say sorry. They don't confess. There are people and incidences where you should be grateful, but you are not grateful. Don't say thank you. And there are certain difficult jargons and words like Worcestershire soup. We find to, have a spelling mistakes. But I have a confession to make that my legs are shaking and I'm not confident. All right. Where is my presentation? Please. Oh, yeah. So I'm going to talk the topic given to me was I wanted to talk about the future of surgery, but they said a lot of people are talking about AI, robotics, augmented reality, virtual reality, mixed reality. I said, okay, I'm going to talk on a new subject, which this particular chapter is usually not taught in the college, not really spread. This knowledge is very limited to the people. But this particular tissue engineering, where people from the medicine and the biology are this is not on, this computer, it's not playing over here. Could somebody? No, it's playing there, but it's not here. So I have to, okay. So where people are merging the engineering technology with the biologist and with all the doctors. And this is the future. So if it is, if I say that in 2 decades time, you will be getting all your organs made in a laboratory and anything will be. At the moment, people are claiming that 95% of the organ can be replaced in the body. We are already having a hip replacement, knee replacement, artificial heart, artificial kidney, so many things. But there is a possibility that heart can be made, kidneys can be made in the laboratory. So this is all about the tissue engineering. But the time has come where the medicine is integrating into, like genomics is coming big way, nanotechnology is coming big way, biotechnology is being integrated, nanomedicine, the vaccine formation, the drug delivery at the molecular level. So there are so many things which is happening. You might be already aware about the word called sarcopenia or senolytics, we are trying to prolong the aging of the tissue, and there is a possibility that human may be surviving up to 140 years. It's just a matter of 20, 30 years time when everything will be repairable and replaceable. So this is the situation where this tissue engineering comes from, and from a pluripotent cell or from your stem cells or the embryonic cells, the tissue can be taken and anything can be repaired. We do face a lot of problems in healing of the wounds, burn wounds, diabetic wounds, like that. And nowadays the artificial skin is available. People have already made patches for the trachea, patches for the esophagus, patches for the urinary bladder and the ureter. This all had been manufactured in the lab now. So we revered Lord Ganesha, where I think we have been champion quite ahead of time, where the head can be transplanted. So it's just like that. Everything has to be repairable and replaceable, and that's the beauty of the regenerative medicine and the tissue engineering. As I said, your life is going to be very long. You can have 4 services, 4 kind of pensions, multiple marriages, whatever you want to do, like that. Why I'm talking this particular topic in a surgical forum? What is going to be the advantage to the laparoscopic surgeon? Laparoscopic surgeons are going to do the repair of the liver with some artificials, the spots and the pieces made in the lab, and you will be implanting on a liver. You will be repairing the bladder that way. You will be repairing the hernia with the artificial, the lab-grown masses, or the tissue engineering made masses where it is going to create a fibrosis. You are going to inject the tissue regenerated materials where it will be avoiding the fibrosis. So it has got a multiple, you will be implanting this artificially grown beta cells into the pancreas. So as a laparoscopic surgeon, it does have a relevance in the future. As I said, there has been challenging chronic wounds and burn treatment and surgical site healing. For that, Integra has come. There are, I think, multiple type of skin preparation has come from the various company, which comes out from the tissue engineering. It could be autologous, it could be made from your own, or it may be made from the other human being, or it may be some biocompatible materials chemically. So, in trauma, you do face a lot of healing problems, a lot of defects, and that can be converted. And this all thing has been possible because of 3D modeling coming into, 3D printing coming into the things. So you have a tissue, you make an scaffold from the 3D, it's a kind of a mess, it's kind of hydrogel, it could be a kind of sugar, it could be a kind of gallium is a substance which has been found to be, when it is cold, it is visible. When at room temperature, it just disappears. So, so people have been able to make a scaffold where your tissue is injected. Your own tissue acts like a ink for the printer, bio-ink. It becomes a bio-ink. And then you engrave it into this scaffolds. And there, people have been, in experimental labs, have been able to make a skeletal muscle which contracts, has been able to make a cardiac muscles which really pulsates, and on addition they have been able to grow vascular tissue, so it gets vascularized. So you can imagine in future you are going to create a 3D model of anything which you need to replace. So skin replacement is there, especially, and there are there are a lot of commercial bone pieces have come which are artificially grown into the lab, and it really works when you are replacing the lost bone at non-union or malunion places. All kind of vascular grafts are available, and that is also, even you can treat all kind of aneurysms, you can replace this thing. So from your own tissue, all these things can be made. And as I said, trachea, esophagus and bladder had been a possibility, so people are expecting in future we'll be able to replace the big organs also, like solid organ also. So the whole process, as I explained to you, that adult stem cells are taken away, then it is cultured, then in a biomaterial, in a scaffold, through the tissue engineering, some growth factors are added, some matrix are added, and then it is delivered at the delivery site. So in today's time, they were even this knee replacement surgery might be at early stage. You might be able to take your own tissue, chondrocytes, and it will be grown into the lab, and it will be injected back to your knee, where it will help in the healing and remodeling of your own bone, and you might not require a replacement. That's the status people are claiming to be. So bone and cartilage regeneration had been a really very interesting field, and people have worked a lot in this particular thing. Already there is a lot of anterior placement of those blocks has been made for the vertebral thing. Spinal injury, people have tried stem cells, little success, little failure, but people are still working on it. And especially orthopedic and maxillofacial surgery, bone graft had been very, very successful. And also the cartilaginous repair is very, very successful, especially in all kind of joint where autologous chondrocyte implantation is done through the injection for the osteochondral defects. So as I said, lost bone can be replaced with the artificial bone, lab-grown bone, but it will have a kind of a biomaterial which is compatible with your body, mixed up with your own cells, where the healing is going to be perfect. So there are many list of items which has been approved by the FDA, and as I said, this can come from the autologous, allograft, or synthetic, or it may be growth factors, bioactive markers. Growth factors has been found to be, my time is up? Oh, so growth factors in bone regeneration has been...
Another 2 minutes.
Okay, all right. These are the chronology where this FDA has approved a lot of bone-related and cartilage-related products to be marketed in the market. 3D printing is certainly made a lot of difference. There are a lot of commercial companies which are producing at the moment titanium one, but soon there will be bioengineered 3D grafts will be available where any kind of defect in your face, especially after the trauma, after the cancer surgery, everything is going to be replaceable. Especially it is going to be used in plastic surgery. Even few plants in alternative material has been, because we are looking for a material which is biocompatible, which is going to be non-toxic and non-carcinogenic. Because most of the items which is being experimented now has got a carcinogenic properties. This is a very well established products, especially PTFE incorporated with your own cells, are going to be less thrombogenic. So this is a very great success, especially in heart valves, all the major vessels, aneurysm repair, and replacement of blood vessels wherever it is required. So it has got various kind of grafts, decellularized allografts and xenografts, synthetic and polymer scaffolds, and tissue engineered blood vessels has been also come into the market. And from your own blood, blood vessels are being manufactured. So various kinds of valves are available, which is tissue engineered. There is a strict criteria which is being followed in manufacturing of those valves. These are the examples of a tissue engineered hard valves, and it comes in various types: electrospin, PGDMA, then 3D bioprinted, self-assembled fibroblast sheets. So it's just your tissue, your own fibroblast, your own stem cells and fibroblasts incorporated, and this is less kind of thrombogenic, and it lasts very long. So in future, in lab, liver and kidney pancreas can be grown. Earlier there was a lot of enthusiasm, but they are so far able to create pieces of it, and those pieces are being implanted on those organ which has failed. Tracheal and esophageal repair has been also a possibility. All Swedish surgeons have shown this, and as I said, there are so many people with the organ failure and waiting for the organs, and most of the people die because they don't get the donors. So the tissue engineering and the stem cells, regenerative medicine is going to be the answers, and you know that the demand exceeds as far as renal transplantation and liver transplantation required. So there are so many things which is happening in this particular field, but it has got a lot of challenges of biocompatibility, vascularization, scaffold design, cost and accessibility, and beside that ethics. So, but still there is a great future where people are working on your genes, on your chromosomes. There is a system called CRISPR, gene editing. With that, all these things are going to be possible. So from a morphological surgeon, you all are going to become a molecular surgeon. That's the message. Thank you.
Thank you very much for your elaborate presentation.
Thank you, sir. Thank you. Before I invite the next speaker, I would like to announce that we are totally pleased to, as a gesture of solidarity to our medical fraternity, we are offering a professional indemnity worth rupees 10 lakhs to all our delegates who are attending this conference. So yes, congratulations to all of us.